Hi, this is Modern Dental Assisting, Chapter 28. This is all about the oral diagnosis and treatment planning of your patient. We're starting at the part of the chapter that is on page 374 in recording the dental examination. So when you're recording your dental exam, you're doing a form of shorthand. So that is symbols and abbreviations and color coding that can be used to record and indicate various conditions and or existing restorations. So this is our way of seeing what is going on with the patient. So this is going to be very complicated when you're looking at it and you're not sure what you're looking at. But if you know what you're looking at, this is a very easy way to find out what is going on with your patient. So this is verbally called out and is recorded by the dental assistant, typically in a blue and red pencil. And these are the findings from the dentist that they find in the patient's mouth and oral cavity. So they record this on a tooth diagram. So the tooth diagram can be in different formats. So it can be in an anatomic or a geometric design, which are the two most frequently used. And it doesn't matter if it is paper or if it's on the computer, it can be anatomic or geometric. So if it's anatomic, it's going to resemble the actual tooth. It's going to look just like the tooth does with the crown of the tooth and the root of the tooth. So it's going to be like a picture of a tooth. If it's a geometric diagram, you're going to have a circle that represents the tooth, and it will be divided into surfaces. So there'll be like a circle, and then there will have a circle in the middle of the circle, which will be your occlusal or your incisal surface. And then it will be broken up into other sections on the outer part of that circle. That will be your mesial, distal, lingual, and either facial or buccal surface. There are different tooth numbering surfaces that can be used. The most frequently used tooth numbering system in the United States is the universal numbering system. That's when you begin at the upper right corner of the mouth, so the maxillary right, third molar, and that is tooth number 1. And it concludes at the mandibular third molar on tooth number 32. So that's the mandibular right. So you start on the upper right corner at number 1 and you go around the arch on the top. So you go number 1 to number 16. Then you drop down to the lower left and you start at number 17 and go around until you end at the lower right at number 32. The ISO or the FDI system is another numbering system. So it's the International Standards Organization System or the Fédération Dentaire Internationale system. So it assigns a 2-digit number to each tooth. The first number is the quadrant number and the second number is the tooth number. So in this one, each quadrant, so it's going to be 1, 2, 3, or 4. So each number, each tooth is always going to start with either a 1, a 2, a 3, or a 4. And then each quadrant has 8 teeth. So each tooth is going to end with a 1 through an 8. So if it's in the first quadrant, the teeth numbers are 11 through 18. In the second quadrant, they're 21 through 28. In the third quadrant, they're 31 through 38. And in the fourth quadrant, they're 41 through 48. It's hard to understand that just listening to lecture, but if you go into class and you ask your teacher to demonstrate that system for you, it's much easier to understand visually. For me, I don't know, maybe for you it's easy to understand, but for me, a visual representation of that system is much easier. And the pulmonary notation system uses a bracket to designate the 4 quadrants of the mouth. So with that bracket, the open side of the bracket is toward the root. The closed side of the bracket is toward the occlusal edge. There are always 2 lines on the pulmonary notation system. So again, that is also easy to understand visually for me. So you may want your instructor to demonstrate the pulmonary notation system in class for you as well. With color coding, so they use color coding so that they know if the tooth has been treated or needs to be treated. So the treatment that's already been completed will be colored in blue or black symbols. So that represents the dental work that has been completed, blue or black. If it is a red symbol, it indicates treatment that needs to be completed at a future dental appointment. So that is like your decay or recurrent decay. Once the work has been completed, you'll mark over that red with blue or black notation to indicate the work has been completed. Some dentists mark silver amalgam restorations in black or blue and composite in red. So it's important to know the convention in the office where you work, because they may take those colors and do different things with them. So you need to understand what they're doing with the color coding in the office that you work in. So earlier we had talked about Black's classification of cavities in earlier lectures. So remember that the standard classification system is universal for all dentists. It's used to describe the location of decay and the best method for restoring the tooth. In G.V. Black's original classification, they included classes 1 through 5. Later on, class 6 was added. So on table 28.1 in your book, which is on page 377, it goes over all of the classes of decay. So in class 1, it shows you that the decay is going to be on the occlusal surface of posterior teeth, on the buccal or lingual pits of posterior teeth, or on the lingual pits of the maxillary incisors. It also shows you that on class 2, it's going to be the proximal, the mesial or distal surfaces of premolars and molars. Class 3 are the proximal surface, the mesial or distal of incisors and canines, so only anterior teeth. Class 4 is the proximal, which is the mesial or distal surfaces of incisors and canines, but you also add the incisal edge to that. So it's only anterior teeth in between the teeth, but you're adding the incisal edge. Class 5 is the gingival third of the facial or lingual of any tooth. So it can be a posterior or an anterior tooth, but it's at the gum line. And class 6 is the incisal edges of the anterior teeth and the cusp tips of the premolars and molars. So it can be posterior or anterior, but it's going to be on the edge of the chewing surface of the tooth. And that's caused by wear and deficits. So with your abbreviations for your surfaces, remember, for single surface restorations, charting the abbreviations are based on the names of the tooth surfaces. So the surfaces are abbreviated with the capital letter of the first letter of the word. So if it's buccal, it's a capital B. If it's mesial, it's a capital M. But when you start combining these surfaces, you're going to use the capital letter of the first word, of the first letter of the word, of each word. So if it's an mesial occlusal, it's an M-O, capital M, capital O, for mesial occlusal. If it's a mesial occlusal distal, it's going to be capital M, capital O, capital D. And it's going to always go M-O-D, mesial occlusal distal. You're going to go from the most anterior part to the posterior. So mesial is towards the front, then the occlusal, then the distal. So here it says in multiple surface restorations, 2 or more surfaces are involved. The combined surfaces become one name on which the abbreviation is based. So when you're combining forms, which is taking 2 surfaces and combining them together, you're going to substitute the letter O for the AL ending of the first surface. So like if it's mesial, you're going to take the AL ending off of mesial. So it's not going to be M-E-S-I-A-L anymore. It's going to be M-E-S-I-O and then occlusal. So M-E-S-I-O occlusal. So you substitute an O for the A-L to make it a combining form. So it would be mesio-occluso-distal. So you take that AL off of the mesial and off of the occlusal because they're both getting added to another word. When you're charting, so the charting systems are available in lots of different diagrams. You're going to place the symbol on the tooth of the dental record to represent the various treatment and the type of dental material used to restore the tooth. So if they say that number 8 has a composite veneer, you're going to mark it and outline the surface, the facial surface of number 8 in blue. That's how you would mark a composite veneer. In some offices, they may do it differently, so you need to know how they mark the surfaces so that you know how to mark a composite veneer in that office. It's important to learn those charting symbols for treatment to be completed, as well as treatment already provided, and if there are any variations in the office that you work in. I can tell you that when I worked in my first office and in my second office, all of the symbols were the same in charting, but the abbreviations that we actually wrote out were different. So when I wrote out my first abbreviations for a crown and a buildup, in my first office, we wrote out CBU, CVP, which means crown buildup, crown veneer to porcelain. When I wrote that out in my second office, they said, what does that even mean? And I said, well, you told me to write crown buildup and crown. So I did. And they said, but the way that we write it is RUC-PFM, which means restoration under crown and porcelain fused to metal, which both of those things mean the exact same thing. They're just different abbreviations. So CBU, crown buildup, RUC, restoration under crown. They both mean the same thing, but they're just abbreviated differently because the doctors went to different schools, so they were taught differently and they write things differently. So depending on what school your doctor went to dental school at, they may say things differently. They may do things differently. So you need to understand what their lingo is, what terminology they're using. so that you can do things the way that they want them done, and that when you're making notes in the chart or writing symbols in the chart or abbreviations in the chart, you're doing it fluidly with everyone else in the office. With the clinical examination of the patient, your role is to escort your patient to the clinical area for the exam. So when you're doing that, you're going to follow a routine protocol for every patient. You're going to walk the patient back and make a light conversation with them. You will seat the patient in the treatment area and make sure that they have their bib or their napkin on them so that the patient is positioned for the dentist to begin the examination. You will always address your patients by their formal name unless given permission to use their first name. So it will be Mr. or Mrs. Smith or whatever their last name is, unless you've been given permission to use their first name or any other name. The first thing the doctor will do is a soft tissue examination. So that involves a complete exam of their cheeks, mucosa, lips, lingual and facial alveolar bone, palate, tonsil area, tongue, and the floor of their mouth. That's going to require the use of a visual assessment and palpation. So palpation is when they are feeling and using percussion to detect any abnormalities in the head and neck area of the patient. So they are going to palpate the cervical lymph nodes, and they can look for infection or any other health issues. So they are going to evaluate the temporomandibular joint, eccentric, lateral, protrusive, and retrusive movements, and they will ask the patient to open and close normally and then move the jaw from side to side. So they're looking for lumps or any similar abnormalities as a means of determining whether there is noise during movement. The examiner listens to the patient as they open and close their mouth, and they might even use a stethoscope on the temporomandibular joint. So the dentist will then examine each surface of each tooth, and then they're going to dictate the findings to you as the clinical assistant. And you will record those findings on the clinical examination form of the patient's record. It is easy and essential that essential that all entries are recorded correctly and accurately, because from this clinical examination form, that patient is then scheduled to have anything that is diagnosed to be treated. And if it's not diagnosed in red on there, we don't know that it needs to be treated, and the patient may not be scheduled. If it is put in red on there and the patient doesn't need it, they may be scheduled for a procedure that is unnecessary. Specific oral periodontal findings can be recorded or to be recorded include overall health and condition of the gingiva. So we're looking at signs and location of inflammation, the location and the amount of plaque and calculus, if there are areas of unattached gingiva and periodontal pockets measuring greater than 3 millimeters, presence of furcation involvement, and mobility. So remember, periodontal pockets measuring greater than 3 millimeters mean that the patient has either gingivitis or periodontal disease. 3 millimeters and smaller are healthy, normal periodontal pockets, and they're easily cleaned out by a toothbrush. Over 3 millimeters in that 4 millimeter area is very difficult to clean with a toothbrush, and over 4 millimeters is impossible to clean out with a toothbrush and has to be cleaned out by our dental instruments. Furcation is when you can see where the tooth splits and diverges into two roots. And if the furcation is involved, that means that there is bone loss. And if there's any mobility, the tooth is moving more than it should be. So we have to make sure that we get a good oral examination on all of our patients every 6 months to make sure that we are providing preventative treatment for them and any restorative treatment that they need. Thank you.